Okay, Appendix 3. Appendix 3 is covering adult intraosseous infusion. Essentially, this is almost identical to that of the pediatric intraosseous infusion. A few extra things we'll touch on in this section. Again, as with all of our lectures, if you have not read the book, you must read the book. There's not 100% of the detail in the lecture that there is in the textbook, so you absolutely must read the textbook. Most of this slide presentation really is on the procedure itself, so I'll talk for a few moments about some of the ancillary information that has to do with interosseous in the adult. There's actually multiple devices and multiple sites that we can use in the adult patient for interosseous infusion. In the pediatric patient, we're really limited to the one site being the proximal tibia, or below the tibial tuberosity. That site remains a viable site for the adult and is used very commonly for the adult. However, there are other sites. There are 3 major mechanical devices as well as the manual intraosseous needle. The manual interosseous needle can be a little harder to get through adult bones because they're strongly ossified and they have a lot more calcium in them. So it can be a little bit more of a challenge to get a manual needle through there. And again, it can be, you could very easily bend it off by putting too much pressure. The other devices, and I'll be placing some information in the course page regarding these other devices, include not only the easy I/O that we learned about with pediatric I/O, but a device and the bone injection gun, or the BIG. But there's another one called the FAST-1, F-A-S-T-1, numeral 1, that is often used in adults, and it was probably the most popular one when adult I/O came about to be mainstream. It has since lost a lot of favor. It honestly looks like a medieval torture device, but and the placement of the FAST-1 I/O is one and only one site, and that is in the manubrium of the sternum. So what is the manubrium of the sternum? We haven't gotten to AEMT yet. Put your finger on your Adam's apple and take your finger and just slowly draw it down towards your chest until you get to a notch. There's a notch at the top of the bone there, at the top of your sternum. You are touching the top of your manubrium. So there's a little, keep drawing your finger down across that bone, headed down your chest, your breastbone. There's a little bump that you'll find just about 2 finger widths below that notch. And really that's the area in which this device is used. It has a bunch of little spines on it that stabilize it, and you punch it down into their chest, and it spring loads and fires and sticks right into the sternum, the manubrium of the sternum there. Not that it's a bad device, it's just kind of a scary looking device. So there are a couple other places and a couple other devices. Additionally, in adults, we may choose to use the humerus, the proximal humerus, or up towards your deltoid or your shoulder area. Occasionally those are used, and you can also use the distal humerus with certain devices. So you could use up by the elbow, or down by the elbow, up by the shoulder, or the standard proximal tibia that we're used to in the pediatric population. Some places have also done some research on the distal tibia, or going further down towards the ankle. And then of course the FAST-1 is the one and only one site to place that, being the manubrium of the sternum. So remember, how does this all work? The bone marrow cavity is very, very vascular. Remember, bone marrow is where the blood is made, and so obviously there has to be transport in and out of there, and so we can constantly have the new blood going into circulation. So this is a good spot to introduce fluids and medications to the body. It flows almost as well, and the medication onset is almost as good, if not as good, as giving it in the IV. So it's very, very efficient. When you cannot readily obtain intravenous access, IO can give you a good, effective alternative very quickly. It would be preferred that we can get an IV, but sometimes you just can't. Cardiac arrests and trauma patients and whatnot, you may have a very difficult time establishing. So IO is a viable option. The contraindications to intraosseous infusion, very similar to those of the pediatric. Bone disease, including osteoporosis when we're talking to adults. Osteoporosis, remember, when you as you age, your bones get robbed of their minerals, and that's what osteoporosis is. Injuries to that bone or in between that bone and the central circulation. Orthopedic procedures near the insertion site. Somebody who's had a knee replacement, you would not want to use that knee to try to put an IO in. Usually it's pretty obvious. There's usually a pretty nice scar right there, so you can usually say, this is maybe not the best one to go with. Prosthetic limbs, of course. You should not put an IO into a piece of plastic or wood or metal or what have you. You've had an IO within the past 24 hours in the same bone because there's obviously a hole in that bone somewhere. Other infections near it, and inability to locate a landmark, of course. Complications are basically the same as those of the pediatric. We have the potential for osteomyelitis or a bone infection, infiltration. We can create an embolism, either air or bone marrow or fat getting into the circulatory system. It is possible to break some bones, so not much different than that of the pediatric IO. Other potential complications, we occasionally will miss the landmark. Maybe have an issue with the needle, not inserting the needle at a 90-degree angle, so you actually are applying pressure to the side of the needle, not to the tip of the needle, and that usually is what causes the bending. Pain, there can be some pain at the site. Not ensuring the placement with flush, making sure that fluid will go in there, and now all of a sudden you just, instead of giving it a flush of 5 or 10 cc's or mLs, you start to try to hook up fluid and it just runs in there, and now it causes a major amount of swelling. Failure to maintain the right amount of pressure. Sometimes you have to have a little extra pressure on the IV bag, and you make sure it's hung way high at the very least, and in many cases put some pressure on the bag, like a blood pressure cuff around it, to help make sure it maintains infusion. And then prolonged needle placement. These needles are okay for up to about 24 hours. That usually buys enough time for them to go to surgery and get a better IV placed. So let's then talk about the process now. This, again, is going to basically mimic the pediatric PowerPoint. It's, again, an easy IO into the proximal tibia. So, again, finding our tibial tuberosity. Find your kneecap, go down until you hit the ridge of your tibia there. Slide over towards the mid, just a hair, so slide just off of it, a finger width or so, to the inside. You should have a nice flat area right there. You fill up a little bit, you find the knobby tip of the tibia, so as long as you're in the flats down there, that's where you want to be. So, that's the proper insertion site, is 1 to 2 finger widths below that tibial tuberosity or that bump. And of course, interosseous, you miss the bone, it's kind of a problem. So test your device, make sure it's ready to go, make sure you have the right needle, and you can get it attached and ready to go. Leave the cap over the needle itself to maintain a clean environment. Cleanse the site using either iodine, alcohol, chloropreps, whatnot. It's important to explain the procedure to the patient, whether they're an adult or a pediatric, because they're going to wonder what the heck's going on. Tell them, you might feel a bit of a pinch, but in general it doesn't hurt. Prime your tubing with a little normal saline. This is just like if we would be doing a saline lock. We hook up our syringe, put a little fluid in the tubing there to make sure we don't have air in there. You can go ahead and leave your syringe attached. Make it as a one-unit thing. It makes it easier on you. You're going to stabilize the leg, holding the driver at and the needle at a 90-degree angle to the tibia, to the flat of the tibia, remember. And then you're going to, of course, pull your trigger and insert the needle according to that device's recommendation. Again, you're going to keep going. You'll feel it give, and once it starts to give, you know you're right there in the right area. So once it's been placed, then stabilize the needle, remove your driver, unscrew the trocar that's down through the middle there, and discard it in the sharps. Hook up your tubing and screw that down to the needle hub. Attach that prime connector. Remember, you've already filled this with saline. And then give them just a little bolus of 5 to 10 cc's of that normal saline. Make sure it flushes through. There's not incredible pain. They're going to feel pressure, but not incredible pain. And we don't see a lot of swelling in that site. So ensuring that a rapid flush is going to make sure that that stays open and it'll flow freely. It can be a little tender. So if using the EZIO, it's recommended you administer some lidocaine. However, lidocaine is not in the typical scope of practice for it's not in the typical scope of practice for AEMTs. So at this point, if you had a paramedic on board, they could give them a little lidocaine in there that will help numb that up. Okay, attach your IV tubing to the three-way stopcock. Set your fluid administration rate. If you need to put a little pressure on the bag to make sure that it's flowing well, you can of course do that. Dress the insertion site, put some bulky dressings around there, and then tape or put some gauze around it. Helps keep it clean and kind of protects the needle a little bit. In reality, the needle itself going through the bone will be very snug in there, but it's good to give a little bit of an extra there. The EZIO device also has a kind of a specialty dressing that they have created for it. It has a little adapter in the middle of basically a big chunk of clear tape. But you put this little clear tape ring around the needle and clip the needle hub into the little adapter in there, and it helps secure it as well. So some various options there. All right, so that wraps up the adult EZIO. Remember, I'll put some more resources on the course page regarding some of those other devices so you can at least take a look at them. And that is it for this section.